The objective of the mouth is to be able to track the lips back, not blocking the nostrils. If you do this, you're closing your dog's nose. So we need to pull the lips back, expose the canine teeth, and then with your finger, open the mouth. So that's where I'm going with this, and then we want them to stay. Now, they don't like this, and these are their weapons, so they don't like people playing with their weapons. So imagine if there's something in there that we need to take out. So the first step is to come and do this pull back. Harriette's like, talk less, train more. Now, I'm often in my sweatpants when I work, and there's a specific reason for this. First of all, I wipe my hands on my pants, and they're disgusting at the end of training, so I don't put on nice clothing to train. So again, pulling the lips back without a fight. For some people, you might actually have to backtrack, which means just approaching and touching the lips without them moving away. So, good job. That would be a first step. I got treated for this. Woohoo! I don't know if I can open the light. I don't know if you'll see her face a little bit better. Should have thought of that first. Okay, Harriette. No, stay. It's okay. Stay. So again, with the traction of the lips backwards, exposing the teeth, we're going to need to put our fingers behind those canines. So you want a dog that's nice with you. Now, just to show you, Albert's very used to this. We can open his mouth and just stay there. Good boy. And he'll keep his mouth open for however long you need it. When he had his gum surgery, Allison, his vet, was really happy that we could just go in his mouth and look and do all this. So the day of the surgery, it wasn't a surprise. We'll see. Okay, so traction back. And then I need to go access those canines. So we're going to put our fingers behind this tooth right here on each side. Whoops, so she's fighting. Nothing. I have nothing. Good girl. So that was a bit harder. So I'm going to give her 3 treats. Albert's 1 treat. Albert, you're going to fall out of your bed. Come. Albert. Hariette, stay. Albert, come. Ooh, that cracks. Okay. Are you okay? There you go. Good boy. There you go. Good boy. You're falling out of your bed. And Hariette, you're going away from the camera. Come. Down. Yes. No, stay. Good girl. So again, traction, hand positioning. Good girl. Good girl. You wouldn't know she had a huge breakfast. Once you have the proper placement for this, you only need 1 finger to open the mouth. Okay, so traction, positioning of the fingers, no fighting, click, reward, reinforce that behavior. Now, zoo animals are all subject to this kind of training because it's necessary. And we can do blood withdrawal, we can do diabetes, medicine through their ears. We can do all kinds of things and train it so that the dog, when he's at the vet, is a lot more compliant. You're on the wrong side again. Come on. Come on, Hariette. Now, Albert, you're okay there. Stay. Come on, Hariette. Down. This side, this side, this side, this side. Yes, good girl. So my next step of training would be safely put these hands behind the teeth and then just drop it open. And I don't want any fighting. So nothing. No, you get nothing. Try again. Whoop. Get nothing. Good girl. Just gonna go 1 treat. Here, you go search for it. So yeah, this is practice. It's called desensitization through our successive approximations. So if you watch the other videos, you know what that means now. Nothing.
Huh? What? I get nothing?
Stay. One treat. Just one teeny tiny treat. Good girl. So when they fight, they get nothing. And it has nothing to do with winning. I know people think that, you know, you're dominating your dog there and whatever. It has nothing to do with anything. It's her being compliant to my demands, which are pretty intense. Good girl. That was a lot better. Oops. Oops. Here, you sit on the other side. Yes, good girl. Sit. Good girl. Perfect. Good girl. That's a lot better. So we use our reinforcement appropriately. So we're aiming for compliance without any fighting. One treat for boobs. Good girl. Yes, so many kisses. Yeah, you're doing very good. Very good. Yeah. What do I do? Click, click, click. Okay. Good girl. Yeah. Okay, calm down. I can do this lying down. I'm okay with that. Whoop. Good girl. I'd rather it be a little bit more shut than having movement, because I can stretch it open later. Good girl. Just get one. Girl bear. You get nothing. Good girl.